Is Radio Doctor on WFM 91.7, Nigeria's first and only radio station for women and their families. It's 15 minutes past 10 o'clock right here on WFM 91.7, and it's the new month. Happy new month, everyone. Happy new month to you, yours, and your loved ones. Happy new month. We're into the month of June 2026. It's been a roller coaster of a year filled with so many emotions, so many things, going on every single day. But we thank God for life. We thank God that we're here. Happy new month. You're welcome to Radio Doctor. Radio Doctor is Nigeria's first specialized health program where medical doctors consult for free and advise you right here on Women Radio. The program airs every from 10 a.m. rather, Mondays to Friday. My name is Folua Kiremi. And today we're talking about something many parents may not know. We're talking about a topic that many parents quietly worry about. But they may not know how to talk about it openly. That's what we want to talk about today. The topic is developmental delay in children. We know that every child grows differently, right? My younger sister, couldn't walk for a long time. It was just some things going on, faster than other people. And it happens for some children like that. They don't walk when their mates are walking. Doesn't mean anything is wrong with them, and sometimes it means something is wrong. So we want to have that conversation today. Developmental delay in children. Some children walk earlier, some talk later, and some are naturally more quiet than the other. Some are slow in certain areas. Children does differ many times, and these delays in development could be signs that a child needs extra support or medical advice. So today we're talking about what developmental delay really means, the early signs to look out for, for parents, what causes it, why early assessment is so important. And joining me today is our radio doctor. She is Dr. Olufumilola Akinola. She is a consultant pediatrician at St. Ives Family Hospital, and she'll be shedding light on helping us to understand this topic better today. The phone lines will be open shortly, so we can call in to ask our question. Good morning, doctor. How are you today? Happy new month.
Good morning. Happy new month. I'm also happy to join you this morning.
You're welcome. So good to have you right here on the show. Now,
Thank you for having me.
yes, we would like to know, talking about development for children, developmental delays for children exactly. What exactly is developmental delay? For somebody listening, they at least have an idea, but they still want to know deeply what is developmental delay in children.
Thank you very much. I will start by saying that a developmental delay occurs when a child does not reach developmental milestone at the expected age. It indicates that a child is developing skill slower than their peers
Yes.
in areas like physical movement, communication, or cognitive thinking. A developmental delay can range from mild to severe, and in many cases, a child will eventually catch up with the help of early intervention. If a delay affects 3 or more areas, it is referred to as global developmental delay.
All right. Thank you so much for shedding light on that. Parents might be listening now and they are wondering, is developmental delay the same thing as disability? So when a child is slow to do certain things, does that mean they are disabled? Is developmental delay the same thing as disability?
Developmental delay is not the same as developmental disability, though they share overlapping symptoms. The primary difference is the time and the permanency Delay are often temporary and can be overcome, whereas disability are lifelong condition. If we define a developmental delay, just as I mentioned earlier, is a temporary behind in reaching age appropriate milestone
Yeah.
like speech, motor, cognitive skill compares to peer. While developmental disability is a chronic lifelong neurological or physical impairment that significantly affects daily function across multiple area. For delay, the delay is temporarily, and
Okay.
with early intervention, children often catch up and delay may resolve completely. But when it comes to developmental disability, it is lifelong. While intensive therapy can greatly improve abilities and independence, the core condition remains present until adulthood. Example of delay, example is autism spectrum disorder, Down syndrome, cerebral palsy, and intellectual disability. They are lifelong to adulthood, while delay will just be temporarily. If caught early, it can be reversed.
If caught early, it can be reversed. All right. Thank you so much for sharing that. I've heard a lot of parents actually say, oh, the child will catch up, the child will catch up. It's not a big deal. But I know that now I want to ask, at what point should parents stop saying the child will catch up and start to seek help? At what point, what should they see that would make them say, I think this is beyond a developmental delay? This is gradually growing into disability.
Um, Parents can usually give the most hope
Hmm.
when a delay is identified early, just as I mentioned,
Yes.
and the child begins receiving consistent early intervention services, such as speech therapies, physical therapies, occupational therapies, while the brain is still most plastic and adaptable. While a child can continue to make developmental gain as they grow, the most critical window for accelerating progress
Hmm.
is between birth and 5 years old.
Hmm. Okay.
By, by age 0 to 3 years, which is the optimal window, this is the most crucial time for brain development. Delay cut here are very responsive to
Mm-hmm.
therapies, and many children fully catch up to their peers by kindergarten. From age 3 to 5 years, many children with mild to moderate delays, especially late stalkers, they catch up within this age bracket. But when it is by age 9 and beyond, in medical and educational terminology, a developmental delay is typically used as a temporary term until age 9,
Hmm.
as children often catch up with the right support before this age. If delay persists beyond this point, they are typically evaluated
Hmm.
as and classified as a lifelong developmental disability. So whichever may be part of delay, either cognitive, speech, um, behavioral, adaptive, by the time it's getting beyond the age of 9 months, I don't think the catch up, you know, can happen again.
Hmm. Wow, it's best to identify it early and then find solution to it quickly. What are some of the early signs that parents commonly miss when it comes to developmental delay? What are some of the signs that parents would commonly miss and they just overlook it, not knowing that it's something to pay attention to? What are some of those signs?
Parents often miss early developmental delay because they appear as normal personality
Mm,
traits
mm,
or baby grow at their own pace. But some of the commonly overlooked red flags includes limited eye contact by 3 months,
mm,
lack of babbling by age 9 months, failing to point to object to share interest by 18 months, and any loss of previously learned skill. There are some of the skills that you expect a baby to learn or develop as they grow up. First is the communication and socialization skill. By age 6 to 8 weeks, 10 weeks,
mm.
you expect that a child should have been develop a social smile, social skill, in which this there is when you smile to a child, you
Yes.
know, you smile at a child, he responsive. After looking at your face, he also do a responsive smile.
Mm-hmm.
This usually occur between age 6 weeks, 10 weeks. But when there's no social smile, that is not responding to a parent smile or voice with queen and smiling back, by age 3 to 4 months, is showing you that there is a problem somehow.
Yes.
So there is a developmental delay when it comes to socialization. You know, at when there is limited gesture, you know, to fail to point to something,
Mm.
wave to you, or reach out for you to carry me, by age 12 months, there is a problem. When there's lack of joint attention, the child does not look at what a parent points to or fail to bring the toys
Mm-hmm.
parents want to show, to show the parent, you know, at at age 12 months, 18 months, there is a problem. When it comes to motor skills, you notice tens of floppy muscle tone, feeling exceptionally stiff
Mm.
or ragdoll floppy when picked up. That is a very early sign. Or when you notice persistent primitive reflexes, there is something we call primitive reflexes like moral reflexes, you know, in which when you suddenly carry a child and drop it,
Yeah.
you notice this child extend the hands,
Mm-hmm.
then adopt it. But if this is not supposed to go beyond 3 months of 3 months, but when it's still persisting beyond this age, there should be, then it's pointing that there is a problem. Then failure to wait beer, inability to sit without support by 9 months, or bear weight on their leg and stand up by 12 months,
Mm.
shows, even if it stop standing to with support, it shows that there is a problem when it comes, or delay when it comes to motor skill.
Yes.
And when it comes to behavior and play, when you notice the child is ignoring his environment, not reacting to loud sound, or not turning their head when their name is called by 6 to 9 months. When you call a child, you should turn their
Mm,
head,
mm,
head towards you. Or when you notice when there is repetitive play, lining up toys instead of playing with them, you know, uh, or driving a car with a toy car.
mm.
It's rather the child is lining it up or piling it up.
Okay.
It's feeling that there is a problem.
Mm,
Then extreme pickiness or tantrum, oversensitive to texture, light, sound, leading to prolonged tantrum when routines are slightly changed.
mm.
It's also pointing to it that there is a problem.
Wow. These are signs I never even knew existed in the first place. But I hope parents are taking notes and are listening, because these are some of the things that we do not pay attention to. We just feel like, oh, it's normal. But these are signs of developmental delay that we should pay attention to fast so we can find solution to them quickly. Thank you so much, doctor, for sharing that. All right. So I wanted to ask as well, what are some of the common causes of developmental delay? They happens at childbirth and all of that, but are there certain things that maybe parents do while the child is growing that causes some developmental delay? Maybe the choice of food, the environment, and all of that, or is it more like an internal thing? What are some of the causes of developmental delay?
Um, Developmental delays in children are caused by a combination of genetic,
Mm,
environmental, and medical factors, including prenatal toxin exposure, premature birth, and inherited chromosomal disorder.
mm, okay.
Some of the genetic chromosomal conditions that cause delay, you know, which are inherited traits or spontaneous mutation, that impact development, occurs in Down, sy- Down syndrome, is caused
Okay.
by genetic. Then, due to extra chromosome, affecting the cognitive ability and the motor skills
Yes.
of the child that is affected. There's also what you call fragile X syndrome. It's
Mm-hmm.
a mutation in the S chromosome that leads to learning and behavioral delays.
Yes.
Then pregnancy and birth complication,
Mm-hmm.
event that occurs before or during delivery can
Yes.
affect early neurological development, such as prematurity and low birth weight.
Mm-hmm.
Babies that are born early often require time to catch up with developmental milestone.
Mm.
When you have what you call hypoxia, in which there is insufficient oxygen reaching the baby's brain during labor,
Mm.
during birth, or even after birth, hypoxia, which is insufficient oxygen, can lead to developmental delay.
Delay. Mm.
Prenatal toxin and exposures, such as maternal use of alcohol, opiates, smoking, excessive smoking
Yes.
in
Yes.
pregnancy, or use of recreational drugs, can lead to lifelong delay
Mm.
of their children.
Mm.
Then when you think about medical and neurological issue, physical uh, health condition during infancy can cause short-term or lasting delay, such as neurological disorder like cerebral palsy in children.
Mm.
It directly impacts the motor skill and coordination. Chronic condition, untreated hearing loss, persistent ear infection, or vision issue can drastically slow cause the delay in speech and language development. Infection that impacts the brain,
Yes.
such as meningitis, it can cause uh, delay both in motor, cognitive, and behavioral delay.
Mm.
Then we also think about environmental factors such as toxic exposure, ingesting lead or second inhaling second-hand smoke,
Mm.
severe trauma or neglect, child abuse, lack of stimulating environment, or parental substance abuse issue, malnutrition, a lack of proper nutrients, hindering physical and cognitive growth.
Yeah.
So these are some of the causes of delay and disability in childhood.
Thank you so much, Doctor. That just means that there are things that we can control as parents and, take precaution for very, very quickly. Now, my next question is centered on, in this generation, we have a lot of children who take a lot of screen time. Parents use that to make them stop crying or, just pacify them on certain situations. So children nowadays have a lot of screen time. Now, I want to ask, can excessive screen exposure affect speech or social development of a child?
Um, Screen time, excessive screen time can affect speech. Research links excessive screen time, which is over 1 to 2 hours daily, when you are exposed to a child to a screen device, either television, phone, which other ones, whatever screen,
Mm-hmm.
you know, that allow them, you allow them to spend more than 1 to 2 hours daily. That one is excessive.
Okay.
So especially for children under the age of 2 years, children under the age of 2 years, under the age of 18 months, you have no, I mean, should not be exposed,
Mm,
you
mm.
know, to should not have be exposed to excessive screen time. That is 1 to 2 hours a day.
Okay.
And because screen, when you call about this television, uh, video games, phones, they reduce the vital face-to-face interaction where children can learn to practice language,
That's true.
read social cues, and build up vocabulary through real word play. You know, children learn language by looking at your face when you are talking, you know, your facial cues, the way you pronounce, all these things are things in which they learn socialization and how to build up vocabulary. But when you face too much television, it doesn't really teach these children,
Mm.
how to do, I mean, all these vital face-to-face interaction. So screen imparts speech development by lack of reciprocity.
Mm.
Language is a two-way street. Watching video is passive.
Yeah.
Children learn to speak by observing lip movement, facial expression, and receiving immediate feedback from caregiver. But when they spend much of their time watching it on screen, this interaction is cut off.
Mm.
You know, every minute spent staring at a device is a minute not spent babbling, making sound,
Yeah,
and
that's true.
practicing conversational tones. Then there is cognitive overload. Fast-paced animation, sudden loud noises can shorten a toddler's attention span and make it harder to process slower real-world communication.
Hmm. I agree with that. And, this is just a call to parents as well to reduce screen time for children,
Yeah.
especially from 0 to 2 years. You think
Yeah.
it's helping them, but it's actually not when we actually look at it. Yes, thank you so much, doctor, for sharing that. Now, what are the kinds of therapies or supports that can help affected children? After a parent has detected this earlier, what are some of the therapies or supports that can help them?
There are various therapy um, that can help that are available to help for children with developmental delay.
Delay. Mm,
One of it is speech therapy.
okay.
By the time you notice that your child is not is not is not babbling at
Okay.
the age of 12 months, please, it is imperative that this child should be managed through these tailored therapies depending on the need of the child.
Yes.
There is speech therapies, there is occupational or physical therapies, you know, that target specific milestone gaps and encourage early intervention. Um, so these are the most important things. We have speech therapies for those that have delayed speech. When it comes to motor skill, uh, then you have occupation or physical therapies.
Mm,
And when it also comes to behavioral delay, cognitive delay, then there is also what you socialization, then there is behavioral therapies.
yes. Okay. Okay. Thank you so much, Doctor. There's so much to learn on the show this morning, and I'm really happy we're having this conversation today. You mentioned that food, choice of food, developmental concerns are some of the things that can cause developmental delay. Now, I want to know, does between breastfeeding and giving artificial foods to children, does artificial food cause some of this developmental delay in children, or it's 100% safe for children to take them?
Um, I don't understand what you mean by artificial food,
Okay.
but whatever things, kind of food
Yes.
that you may give your child, study have proven it several times that breast milk
Mm-hmm.
for the first 6 months of life uh, is the best
Yes.
for your children. There is nothing that can be compared with mother's breast milk.
Mm.
It helps in the growth and development of the child, improve cognitive development. So breast milk, when you compare to whatever one,
Mm.
um, is the best, rather than using formula milk,
Yeah.
which are
Yeah.
processed from
Exactly.
goat
Processed food. Yes.
or cow milk,
Mm, mm.
from animal. You cannot compare it with the mother's breast milk, and the composition is also a little bit different, but there is nothing that can be compared with the mother's breast milk. And as the baby grows up, by age 6 months, it's
Yes.
better to introduce, you know, food, organic food,
Mm-hmm.
that are grown from the farm that are not over processed,
Yes.
to this child, along with breast milk, till this child is fully eating and taking all family diet by the age 1 year or 2 years.
Yes.
So whichever one, from age of birth to 6 months, breast milk is the best, for babies.
Thank you so much, Doctor. Finally, before we go, what's your final message to parents and caregivers for them to remember about developmental delays? And also for parents who, they feel a little scared, maybe due to what they're afraid to seek assessments because of fear or shame. What would be your final words to them?
Um, what we learned this morning is that developmental delay is different from developmental disability.
Yes.
So when you notice a child that have delays, and this child is caught up early and introduced to therapies that may help,
Mm-hmm.
this child may be able to catch up with his or her peer, if they are caught up early. So uh, parents should open their eyes early and ensure that they follow up with their child developmental milestone. And
Yes.
this is why baby clinic is very, very important. And this is also what we practice in St. Ives,
Hmm.
in which we follow up babies from birth to 2 years. There is specific time, either your baby is well or they are not well. Please, they need to be followed up, so that when they are missing out in some of these milestones, they are caught up early and they are introduced to the therapists that may be able to help as soon
Yes.
as possible so that they can cut up with their growth.
Awesome. Thank you so much, Dr. Akiola, for joining us today, and most importantly, for helping us understand better developmental delays in our children. Thank you so much for being here, Doctor.
Thank you for having me today.
You're welcome. And to the parents listening, please pay attention to your children early. And, paying attention early is not panic. Sometimes early support can completely change a child's long term outcome. So, when you notice anything about your children, it's important to seek medical help. It might be a delay in their speech, delay in movement, learning, or even social interaction. So, don't ignore them. Don't ignore these concerns. Don't assume that you know what's going on or how to handle it. Seek professional guidance early. Thank you for listening, and we'll hope that you do have a very healthy day today. And don't forget that Radio Doctor on WFM 91.7 is Nigeria's first free consultation specialized radio health program that broadcasts from Monday to Friday, 10 a.m. Do join us tomorrow by 10 a.m. for another Radio Doctor. My name is Finfolua Akiremi, and to the executive producer, Tomu Okiwali Shonaya, thank you so much. Thank you for listening, and do have a healthy day. Bye for now.